Next, I'm going to invite the conference chair. Without him, we wouldn't be here today for the conference, Dr. Amanur William. Let me just introduce him, a little bit of his background. He's a healthcare executive trained from Rotman School of Management, University of Toronto, and also a physician with a Master of Public Health and trained in emergency medicine from the University of Wisconsin in the USA. And also he is a PhD candidate of public health and is currently working with First Nations in the North Atlantic region under Indigenous Services Canada. He has a lot of experience and knowledge to share with us today. So without further ado, I'm gonna invite Dr. Amanur William. So please put your hands together.
Dear ladies and gentlemen, welcome. It's my honor to welcome you to this conference, Carelinks Conference 2024. Addressing challenges to equitable HIV outcomes for communities in greatest need. I would like to recognize our distinguished presenters. One of them, a renowned infectious disease and a pioneer of HIV medicine, Professor Walter Slake. We also have Professor Lawrence Mbagwa from McMaster. You're most welcome. I also want to welcome all our distinguished speakers from different parts of the continent. From Canada, our friends from Manitoba, we have people from Kenya. You are most welcome. Before we dive into serious discussions for this conference, I would like you to ponder on a question. What would you do if you are told you are left with 24 hours to live? What would you do if you are told you are left with 24 hours to live? I want to recognize our partners, Bayshore, for having supported this conference. Humans of Valor, we know some people are still on their way. You know, Toronto is highly trafficked, especially during the working days. We believe they will be getting here soon. I would also like to appreciate Reverend Brad Bleno for your time and unwavering support to Carelinks. I also want to recognize the work of the team of Carelinks. We have a team of volunteers who have been putting together this conference to happen. Our theme today, addressing challenges to equitable HIV outcomes for communities in greatest need, points to the urgent need to close the disparities in service provision and coverage, as evidence has shown that certain social groups are left behind in receiving HIV/AIDS services. In sub-Saharan Africa, HIV epidemic control cannot be achieved until and unless significantly greater focus and resources to meet the needs of those most vulnerable. HIV infection and illnesses, adolescents and young adults, and particularly key populations have been addressed. Globally, it is currently estimated that 65% of new HIV infections occur within key populations. And most of these groups, 17% of new HIV infections, are found in Africa. East and South Africa, where the majority of the incidents are occurring, almost at 42%. This is according to UNAIDS report. Our focus, therefore, is to draw attention to all policymakers and funders to support key populations and organizations serving key populations like Carelinks. Carelinks focuses at addressing barriers to service provision, especially for key populations in Black and Indigenous communities, and also to address the systemic racism that blocks the access to equitable healthcare services. Putting this into perspective, Carelinks is continuing to address barriers of access to care, and we developed tools. We've developed PrEP videos. We've developed magazines. We've trained community health ambassadors to reach out to communities that are in their need of information in addressing HIV/AIDS. I will not take much of your time, but I want to welcome you again to Toronto. For those who are visiting Toronto for the first time, welcome. You have will be ending this conference tomorrow a little bit early to give you some time to visit Toronto. And one of the places probably you'll be interested to meet to see is the CN Tower, the third tallest tower in the world, after that one of China and Japan. This conference, as I have said, is being supported by Bayshore and Humans of Valor organizations. Once again, welcome to Toronto and to Carelinks Conference. Thank you.